Let's discuss the previous year questions from INICET 2022 of orthopedics. So, the first question is the most common pattern of involvement in Pott's spine is. So, first of all, we have to understand the term Pott's spine. Pott's spine is the tubercular infection of spine. Okay, so it occurs via spread of secondary spread from pulmonary or GI gastrointestinal primaries and it spreads via Batson axis of veins. The most commonly involved part is dorsal-lumbar region. The pattern of involvement is most common one is paradiscal involvement. We know what do you mean by paradiscal? Means one intervertebral disc is this and this is this. So in Pott's spine, the involvement is like this. Both the discs and intervertebral disc. So this type of involvement is known as paradiscal involvement. Now let's move towards the other question that is anterior dislocation of the shoulder is likely to result in the damage of which of the following nerves? In anterior dislocation of shoulder, the most commonly involved nerve is the axillary nerve. We know this. Okay. Now let's move towards the other questions. A 60-year-old patient presents with a limping gait and a left hip pain. What is the likely diagnosis? Here the radiograph is given. Here in the radiograph, we can see the findings of radiolucency and distorted articular surface. Here, it is the radiolucent area and the articular surface is distorted. This is suggestive of avascular necrosis of head or femur. So we have to rely on the radiograph here, which suggests the avascular necrosis of femoral head. So the answer to this question is avascular necrosis of femoral head. Now the next question is a 72-year-old male came with the complaints of unilateral knee pain. Okay. And X-ray examination showed reduced joint space. Pathological findings are shown below. What is the diagnosis? Okay, so the scenario is like this unilateral knee pain and radiograph showing reduced joint space. And in histopath finding, we can see that there is loss of articular cartilage. So all the features are suggestive of osteoarthritis of the knee joint. So the answer to this question is osteoarthritis of the knee joint. Let's move towards the other question. Which of the following is false? Which of the following is false regarding hip dislocation? So let's see the options. So first option is posterior dislocation of hip has flexion and adduction. We all know this is the correct answer, correct statement because in posterior dislocation, the mnemonic is farther. Okay, that is flexion, adduction, and internal rotation. And in anterior dislocation, we have favor, that is flexion, abduction, and external rotation. Now, the first is the correct answer because posterior dislocation has flexion and adduction. Okay. The next option is vessel injury more common in anterior dislocation. It is also the correct statement. Now, the next answer statement is nerve injury is more common in anterior dislocation. This is the false statement because nerve injury is more common in posterior dislocation. Let's see the last option. Posterior dislocation is more common than anterior. This is also the correct statement because we all know that in hip, posterior dislocation is more common than anterior dislocation. So the answer to this question is option C, that is nerve injury more common in anterior, which is the false statement. Now let's move towards the other question. A 35-year-old man presented with the knee pain. The X-ray of his knee joint is given below. Which of the following is the probable diagnosis? Here we have to see the X-ray which shows the soap bubble appearance. That means soap bubble appearance is characteristics of giant cell tumor, that is osteoclastoma. So the answer to this question is option C, that is osteoclastoma. Now let's move towards other question. Question number 7. Book test is used to assess the function of adductor pollicis. Okay. Which of the following nerve supplies this muscle? So this is the fact-based question, and the answer to this question is ulnar nerve. A 6-year-old girl sustained a fracture of lateral condyle of the humerus, which led to the development of elbow deformity. Which of the following findings can be seen in this patient? Here we can see that there is the injury of lateral condyle of the humerus, if this is the lateral side. So we all know that behind the lateral condyle of humerus, there is a nerve passing. That is the ulnar nerve. Okay. So due to the injury to this nerve, we leads to there is a fracture of lateral condyle of humerus, which leads to the injury of ulnar nerve, and it can lead to tardy ulnar nerve palsy. And the feature of ulnar nerve palsy is inability to adduct the fingers. So the answer to this question is option C. All the other options are the test for median nerve. Okay, let's move towards the other question. A 65-year-old postmenopausal female present comes with persistent backache, not responding to conservative treatment. She has a history of lifting heavy weights 4 months back and progressively increasing pain that worsens on walking. Okay, the pain starts radiating down her legs after walking for a distance around 100 meters. However, she feels no pain on walking uphill. Okay, this is the important buzzword we can say. There is no pain on walking uphill. What is the most probable diagnosis? As the clinical scenario is given, an old woman with back pain. Okay, old woman, postmenopausal, backache, and that worsens on walking and relieves on walking uphill. Okay, all of these points towards the diagnosis of lumbar stenosis. Okay, so the answer to this question is option B, that is lumbar stenosis. So the next question is disruption of axon with an intact endoneurium. This is the buzzword, that is intact endoneurium is seen in which of the following? So the answer to this question is axonotomesis. That is option C. Now the next question is a patient presents to the OPD with Trendelenburg sign positive on one side. Which of the following muscle? Trendelenburg sign is positive on one side. Which of the following muscles are involved? We all know that Trendelenburg sign positive means there is involvement of gluteus medius and minimus. Okay, gluteus medius and minimus. And both these muscles are abductors of hip. So the answer to this question is hip abductors. So there is two, only two. This is option A. Now let's move towards the other question. That is, you visit a newborn near your house and notice the baby has CTEV as shown below. This is the CTEV. Okay. When would you advise baby's parents for a consultation to put on a cast? We have to advise them as early as possible. So let's see the options. In 1 month, no, no, no. In 6 months, never. In a few days, this may be the answer. When the child starts walking, no, it's too late. So the answer to this question is C, that is in a few days. Now, next question is combination of appearance in CTEV. We all know CTEV presents with cavus, adductus, varus, and equinus. Let's see the options. Equinus is present in all the options. Eversion. Eversion is not there. There is inversion. We have seen in the diagram in the previous question, na? This is the leg of the baby. It shows inversion, not eversion. So the equinus and inversion. So A and C is cancelled because of eversion. Now, forefoot adduction, both have forefoot adduction, but we have cavus, not planus. So, the answer to this question is option B, that is equinus, inversion, forefoot adduction, and cavus. Now, the next question is the child presents with poor growth and swelling at joints. The radiograph of his wrist is given below. Lab investigations reveal serum ALP levels of more than 1500. The child has poor growth, swelling at the joints, and the radiograph is given, uh, which shows cupping and splaying of joints. Okay, and the ALP level is more than 1500. All these points towards the diagnosis of rickets. So the answer to this question is option B, that is rickets. The next question is what is not required on an emergency basis in an open fracture? Closed reduction, internal fixation, splinting, or and antibiotic coverage. So we all know in emergency management of open fractures is mainly focused on emergency management of open fracture is mainly focused on prevention of infection. Okay. So to prevent infection, we can do splinting and antibiotic coverage. And the closed reduction may also be done. But internal fixation is not done due to risk of infection. Okay. So the answer to this question is internal fixation is not done, not required. No? The question says not. So the answer to this question is B, that is two only. Let's move towards the other question. Which of the following structures are involved in the unhappy triad? We all know the unhappy triad consists of MAM, that is medial meniscus, anterior cruciate ligament, and medial collateral ligament. Okay, so let's identify all of them. This A is ACL, B is medial collateral ligament MCL, and the C is medial meniscus. So the answer to this question is ABC, that is option C. Let's move towards the other question. The radiograph of the wrist is given below. Identify the true statement regarding this condition. Let's identify the condition first of all. This is the condition of GCT, that is giant cell tumor or osteoclastoma. So we have to identify the statements which are true regarding osteoclastoma or giant cell tumor. So The first statement is the age of occurrence is 40 to 60 years of age. It is the wrong statement. Second question is ground glass appearance on X-rays diagnosis. No, because the soap bubble appearance is diagnosis on X-ray. Let's see the third option. That is, it has an epiphyseal origin. It is the correct statement. 30% of cases undergo malignant transformation. It is also the wrong statement. So the answer to this question is option C, that is 3 only. Thank you so much, guys, for having patience and listening me out. All the very best. For any queries, you can contact me on the email address displayed on the screen. Thank you so much.